I'm Brenda Metzler with Let's Grow Kids, and today I've invited a trusted team of Vermont medical professionals to talk with us about RSV. I really appreciate your time, team, and your expertise, and I look forward to hearing your guidance. Brina, why don't you introduce us?
Hi, everyone. This is Brina Holmes. I'm a general pediatrician. Some of you know me from a long-standing role I had at the health department, but I am now at the University of Vermont at the Vermont Child Health Improvement Program. We wanted to kick off today by introducing you to this great panel. We have Molly McClintock and Katie Leffel from the Vermont Department of Health. They are public health nurses, hopefully very familiar to you for their work in all things COVID, but also childcare, health and safety in general. And then we have Dr. Becca Bell. She is our AAP Vermont president, but she is also by day a pediatric pediatric ICU doctor. She does know a lot about infections as well. And we are really grateful for Let's Grow Kids for this opportunity to talk with you. I wanted to start by just acknowledging again, I can't believe I have to say this again, we are in ongoing hard times with our littlest children and virus. Today, in particular, we're going to be talking about RSV, but I did want to acknowledge that a tough respiratory season impacts you all so greatly, not just because of children's health and trying to figure out who has COVID, who has other respiratory viruses, but you've also got some very significant impact on the health of your staff, and it impacts your ability to keep your classrooms open and to care for children. So in that space, we really want you to feel that your children in your program, your medical homes, the pediatricians, family medicine physicians, everyone around you can lead the decision-making about testing and who has which virus. It's very difficult to put you in the middle between parents and those healthcare providers. We also have very aspirational and ongoing hopes and dreams about the way that you all relate to the medical professionals in your community. The communication between you is critical. We don't have the time and the structure to slow down and get that all right now, but it is enough to say that you will have ongoing support of your pediatric leaders and your health department leaders to try to figure out as we move forward in the world, what are the right ways to stay in very tight communication between these two spaces in which children live, and the communication is super important. And now I'm going to turn it over to Dr. Rebecca Bell. She is a pediatric intensive care physician at University of Vermont Medical Center and also the American Academy of Pediatrics Vermont chapter's current president. Becca?
Hi, all. Thanks for having me. We're going to talk a bit about the respiratory viral illnesses that we're seeing in our clinics and in our ERs and in our hospitals today. There are three main take-home points, though, that I'm going to start with, and then we're going to go into more detail. And one is that RSV is really everywhere right now, along with a bunch of other viruses. And because we don't test for these viruses, we don't need to let folks or alert families about whether or not there are RSV cases in the child care environment. So we know there's tons of viruses going around. We're going to take precautions. We're going to talk about that, but we don't need to let families know about specific RSV cases or other types of viral illnesses going around. So that's one. The second is that this is something that pediatricians know a lot about and are going to be best equipped to decide with their families, with your recommendations about who they see and what they do in terms of care for these children. So many of these children who get sick are not going to need to be seen in the office. And so having your families, if they're worried, call their child's doctor is what we recommend. Some may be seen in the office, some may not be seen, but they don't need to be tested to find out what virus they have, and they don't need a note to return to childcare. We're going to use the same stuff we've always used in terms of who can come to childcare and not. And then thirdly, just thinking a bit about how RSV and other types of these viruses spread. And that's really not so much airborne like COVID, but it's through touching things, contact and close contact droplets. So we'll talk a little bit about cleaning and cases where you might want to think about masking as well to help reduce transmission. So we'll go more into detail, but those are the three main things that I want to focus on for this talk today.
Great, thank you. Becca, what is RSV?
Yeah, great question. We're hearing a lot about it in the news, and RSV stands for respiratory syncytial virus. It's a very, very common virus. We have all had it. In fact, we've all had it usually by the time we're 2 years of age. So kids get it. And it's one of those things that you can get over and over again. So children get it over and over again. Adults can get it over again, especially if they're in contact with kids, as you all are. And for most people, it presents like a common cold. So it's some stuffy nose, congestion, and a cough, sometimes a fever. But for some people, the infection can sort of travel down deeper into the lungs, into the lower airways, and it can cause inflammation of the small branches of your airways, and it can cause pneumonia. And for especially our very little infants, they just have smaller airways. And so any inflammation, mucus buildup can be really challenging for them to clear. And so they can have difficulties breathing. So everyone, like I said, everyone under the age of 2 generally gets RSV by the time they're 2. It's very, very common. So, most kids are getting it each season. And it's a pretty common reason to be hospitalized. About 58,000 kids under the age of 5 are hospitalized every year in the US for RSV. So common reason to get hospitalized. However, it's still within an individual patient, not so common to be hospitalized. So if you have a child, your own child or a child in your care, the likelihood that they're going to be hospitalized is still pretty low. Those who are most at risk are infants under the age of 6 months, especially if they were born early or they have underlying lung disease. So a baby who spent some time in the neonatal ICU who's now on oxygen at home, for instance, that child is going to get sicker with RSV. And even within that cohort, the under 6 months of age, for every child in that age group who gets RSV, about 1 to 2% will be hospitalized. So still still a small number. It's just that everyone gets it. And so, we can get busy in the hospital. So that's what RSV looks like. Again, mostly it's in infants, but older kids can also get sick from RSV. And in particular, we are seeing this year, those kids that haven't had RSV yet because of the pandemic. You've probably noticed it's been kind of a nice silver lining of the pandemic. There hasn't been a lot of respiratory viral illness. And so a lot of kids are getting RSV for the first time now. And so they may be 3 or 4 or 5 years old. And oftentimes the first time you get it, it's a little bit more severe. So we're seeing some of those toddlers and school-age children as well. And what it looks like in them is kind of like an asthma exacerbation. And so it's sort of unmasking asthma, or it's bringing back asthma in kids that have been known to have asthma. So that's kind of the population we're seeing. And it's really the childcare population and sort of the elementary school age population.
Thank you. Tell us about the current state of RSV in Vermont and the Northeast.
Yeah, so again, we're hearing a lot of this on the news. And so what we're seeing is a really, really busy RSV season. Typically in Vermont, our RSV season, it kind of peaks January, February, March. So we really only see it in the winter, and that's really the busy time. Since the pandemic, we've been seeing RSV at odd times, sometimes in the summer. We saw some last fall. And right now we're having a very busy RSV season. So instead of having it in the winter, we're really having it right now. And so we're seeing those infants who are getting sick. We're also seeing those toddlers, and it just makes for a really busy pediatric practices. It makes for busy ERs, and it makes for busy pediatric hospitalizations. In some parts of our region in southern New England, there have been recent closures of pediatric hospital floors and pediatric ICUs, and that has created this ripple effect where there have been really limited beds for children who need help with RSV and other respiratory viral illnesses right now. And that's the stuff you're probably hearing on the news. Right now here in Vermont, we serve children in Vermont, we served children in northern New York, and we're able to accommodate all the children that need hospitalization and all the children that really need help. But all of this busyness really ripples out. So our pediatric and family medicine colleagues who see patients as an outpatient, they're super busy. They're getting lots of calls from families. ERs are very busy, and we're really busy. So everyone's really busy, but we right now are able to accommodate the children that need hospitalization. And one thing I want to let folks know about is that the RSV that we're seeing this year, it's not more severe in any individual patient than it's been in the past. So kids are getting as sick as they normally would. But what we're seeing is just more kids getting it at the same time. So that's what's creating the stress. It's not that RSV is different. It's not that the virus is different. It's not that kids are reacting to it in a different way than they have before. Again, this is like the most common thing we care for. We know it very well. It's acting the same as it normally would. It's just more children than we're used to.
Good to know. Is testing the only way to confirm an RSV diagnosis?
So just like any other virus, the only way to know for sure that you have that particular virus is to test for that particular virus. So just like COVID or RSV or influenza, you would have to do a test to know for sure that's what you have. But the question really is, does that change anything? And it really doesn't. So there's no specific treatment for RSV. And so we don't actually test for it typically because it doesn't change what we do. So we also have a few other viruses going around right now. We have rhinovirus, which is a very common virus, also that can cause some similar symptoms. And so, you know, we have children, when they come into the hospital, we test them so we know exactly what they have in terms of who they could be around. And we have children in the ICU, you know, one with rhinovirus, one with RSV, and we're treating them exactly the same, giving them fluids, giving them oxygen, giving them other types of breathing support. So it really doesn't change anything to know what virus is causing the illness. What we really want to focus on is what are the symptoms that your child is having and when to seek care. So we tell families that, you know, starting again with infants, they can have, with congestion, they can have a lot of trouble feeding. It can make it hard to feed, and the feeds can take longer, and that's okay, but we want to make sure they're getting the same nutrition that they normally get and that they're making wet diapers. So if that's not happening, that's a reason to call your pediatrician. If the child is breathing hard, so using extra muscles to breathe, and you can see that sort of in the neck muscles, you can see that in the belly and the chest muscles, that's another reason to call your pediatrician or to be seen. Just congestion and cough, those things are very annoying, but they're oftentimes don't require a child to be seen by a healthcare professional. They can always call the office and check in with the nurses who are doing triage there. And again, like, this is something we see so much of, so we really know how to triage these cases. So for my outpatient pediatric colleagues, they are getting lots of calls from families and describing mild symptoms, and they do a really good job of telling them, families, what to look for, what to call back for, what to come in for. So many children who probably have RSV are not necessarily being seen, which is okay. We can't see every single child. We need to know which children do need to be seen and be brought into the office, which children do need to come to the hospital. And so so that's something that's happening within the medical community, is trying to decide who needs to be seen and what needs to be done. But there isn't it's not like there's a special treatment where if we caught it early, we could start a treatment and it would change the course. It doesn't really change it, unfortunately. So we don't recommend testing for those reasons, because it doesn't change anything.
Thank you. And what can we do to protect the health of our children and staff?
Yeah, so one thing we can think about is trying to prevent transmission as much as possible and understanding who gets the sickest. So again, everyone's generally gets RSV by the time they're 2. So it's not something that can be avoided forever. But we really want to try to avoid it in our youngest infants. So those under 6 months, or who are born premature, have underlying serious heart conditions or serious lung conditions. So those children we really want to be careful around. So how is RSV spread? So it's spread through contact. So this is different than COVID. So this is a case where if the RSV, the virus, can actually live on surfaces, especially hard surfaces, tables and such, and you can touch it. And then if you touch, your own nose or mouth or eyes, or you touch someone else, that is a way that RSV can be spread. So through contact. So this is where we want to go back to thinking a lot about hand washing surfaces, and then thinking about how close we get to, especially those infants. So I recommend to families, not having people, kissing their baby and touching their baby's face and touching their baby's hands. But if you're a caregiver, you're going to be doing all that stuff. So just really frequent hand washing. And then the other way RSV can spread is through droplets. So if somebody coughs or sneezes really close to somebody else, it could transmit that way. And so that's an instance where mask wearing could be helpful, because it can help act more as a barrier to protect, to prevent those droplets from spreading. So, and then of course, if we're feeling sick, we don't want to come to work or go to school or childcare. And really, again, thinking it's very similar to the way we think about COVID, where it's early on in the infection and the illness, that's when we're most infectious. And so kids this age, they kind of have they'll have lingering symptoms for a long time after a cold. So we want to think about when is the time they're most infectious, and it's at the beginning of the illness when they're just starting to get sick, they've got fevers. Those are reasons why they should be home from childcare. We do know with RSV and with rhinovirus and all those other things that they do tend to have a lingering cough, sometimes for many weeks afterwards, and we don't think they're infectious during that time. So it's really those early stages that we want to try to avoid of being around other people. And then I would also say that because we are seeing older toddlers and school age kids who are having asthma exacerbations due to either rhinovirus or RSV, we are just letting families know, like, if your child has been diagnosed with asthma in the past, maybe when they were younger, they were diagnosed with asthma, they were put on some inhaler, but then they haven't needed it in a long time. Now we're seeing a lot of asthma again now. So now's the time to talk to their medical provider and say, hey, my child was on inhaler a couple of years ago, should they go back on now? And the answer is going to be yes. So that's another way to sort of minimize the asthma exacerbations that we're seeing that the viruses are causing.
Thank you. Molly, Katie, would you add anything?
Yeah, Becca did a really thorough job. It's great. I guess I would just reinforce that RSV is very prevalent right now, and we don't need to necessarily be notifying families of every RSV case in a childcare setting. And so it's just sort of a general reminder that RSV is common in the community and should be sufficient. And just always that reminder to help prevent other infections like flu and the whooping cough. So making sure the adults and older children are up to date on their Tdap vaccinations, which is every 10 years for adults and a slightly different schedule for younger kids. And then getting the flu vaccine. So it will help prevent getting the virus and/or it will help staff get less sick if they do get the flu. So we're just urging everyone from 6 months and up to get the flu vaccine right now if you haven't received it. Children and staff can get the flu vaccine at their doctor's office, pharmacies, or through state walk-in clinics. And the Department of Health has a website for clinic schedules on it.
And then I would just add, Becca touched on it, but just to continue to reinforce basic respiratory hygiene. So washing your hands frequently and encouraging families to take those behaviors home as well. So encouraging frequent hand washing at home. You don't want sick kids going into school, and you also don't want your healthy kids going around people who are ill. So trying to limit that exposure to ill people, and limiting exposure to crowds, because like we've said, there's a lot of illness going around. And then if it's appropriate, wearing a mask. So like Becca said, if someone is sneezing and coughing, if they're really close to you, that can transmit it. So wearing a mask can help prevent transmission in those cases. And especially for kids, if they are touching everything and then touching their face, that's a really great way to spread RSV. So it can just help prevent that touching from happening, which can help prevent transmission. And then as weather permits, keeping areas as ventilated as possible.
It's all very practical and useful information. Thank you.